A 67-year-old man, someone who gardened every weekend, took his daily walk without fail, and had passed his last 2 physicals without a single red flag, went in for a routine cardiovascular screening last spring. His doctor found significant arterial buildup, blockage that had been developing silently for years. And it was only because his wife had insisted on that appointment, after noticing something small, something easy to dismiss, that the outcome was different from what it could have been. What stopped her from letting it go was a conversation she had heard, information she had carried with her, the kind of information that changes what you do next. What she had noticed in him, the thing that finally prompted that call to the doctor, is something that happens in millions of households every single week, often written off as nothing. I am not sharing this to alarm you. I am sharing it because his story, and what his doctor found, and what both of them learned in the months that followed, may be more relevant to your life than you are currently aware. What his doctor told him that day, and what I'm about to walk you through, is information that every person over 60 genuinely deserves to have. By the end of this, you will understand what was happening inside that man's body, why it went undetected for so long, and what a single, ancient, commonly overlooked herb has to do with changing that picture entirely. His story is not unusual. That is the part that matters most, because when you sit with the data, when you look at what cardiovascular research has been telling us for the last 2 decades, what happened to that man in his garden, living what he believed was a healthy life, turns out to be one of the most common medical narratives in the developed world. The American Heart Association estimates that nearly half of all adults in the United States are living with some form of cardiovascular disease. Not all of them know it. In fact, the majority of cases involving early to moderate arterial plaque buildup produce no symptoms that most people would recognize as dangerous. They produce fatigue. They produce the occasional shortness of breath that gets blamed on age. They produce a kind of low-level unwellness that fits so neatly into the story we already tell ourselves about getting older that we simply absorb it and move on. That man in the garden had been absorbing it for years. He told his doctor afterward that he had assumed the tiredness was from the heat, that the occasional tightness in his chest after climbing stairs was just deconditioning, that the slight change in how he felt on his morning walks, the way he needed to slow down more than he used to, was simply the body doing what bodies do in their 60s. Every single one of those interpretations was reasonable. Every single one of them was wrong. And here is what the science tells us about why this pattern repeats with such consistency across so many people living so many different versions of the same story. Arterial plaque, the dense, fatty, inflammatory buildup that accumulates along the inner walls of blood vessels, does not announce itself. It does not send a clear signal. It builds over years, sometimes decades, in a process called atherosclerosis, and it does so in a way that the body actually compensates for until a very late stage. The vessels adapt. They remodel around the obstruction. They maintain blood flow, often adequately, until the blockage reaches a threshold that the body can no longer quietly manage. By that point, the window for the most effective intervention has often narrowed considerably. Which is why what his wife noticed, and what she did with that noticing, made the difference it did. What that appointment revealed about his habits and what it means for yours is where this becomes truly important. The medical reality beneath his story is something that most people never get a clear explanation of, not because doctors are withholding it, but because the way cardiovascular disease develops does not fit neatly into a single appointment or a single conversation. Atherosclerosis is a slow inflammatory process. It begins, in many cases, with damage to the endothelium, the thin, delicate inner lining of the arterial wall. That damage can come from elevated LDL cholesterol particles that penetrate the arterial wall and become oxidized. It can come from chronically elevated blood pressure that creates mechanical stress on those vessel walls. It can come from blood sugar dysregulation, from smoking, from systemic inflammation driven by diet, sleep deprivation, or chronic stress. Often, it comes from several of these sources, operating simultaneously over many years. What happens next is a biological cascade. The immune system, recognizing the oxidized LDL as a threat, sends white blood cells called macrophages to the site of damage. Those macrophages consume the oxidized cholesterol particles and become what researchers call foam cells. Foam cells accumulate. They form fatty streaks along the arterial wall. Over time, those streaks develop into plaques, structured deposits that include cholesterol, calcium, cellular debris, and fibrous tissue. The plaque narrows the arterial channel. It reduces blood flow, and in its most dangerous form, it becomes unstable, a vulnerable plaque that can rupture, triggering the clot formation that causes a heart attack or stroke. That man's screenings had not caught this because the early and middle stages of this process produce no measurable change in standard blood pressure readings and no symptoms that would prompt a physician, without additional imaging, to look deeper. His total cholesterol had been borderline. His blood pressure had been managed. On paper, he looked like a man doing most things right, and yet the process had been advancing beneath the surface the entire time, driven by a pattern of inflammation that standard panels do not always capture. The medical explanation for what was happening beneath the surface is something most people never get told clearly. Until now. And understanding it is the foundation for understanding why what comes next, the specific compound that changed his picture, works the way it does at a biological level. Why catching this early changes everything is not a phrase designed to create urgency for its own sake. It is a clinical fact with a very specific meaning. The research on cardiovascular intervention timing is consistent and clear. The outcomes available to someone who identifies arterial inflammation and early plaque formation in its beginning stages are categorically different from the outcomes available to someone who discovers it after significant stenosis, narrowing of the arteries, has already occurred. In the early stages of atherosclerosis, the arterial wall retains a degree of plasticity. The endothelium can heal. The inflammatory processes driving plaque accumulation can be interrupted. Existing soft plaque, the earlier, less calcified deposits, can stabilize, shrink, and in some documented cases, regress. The window for that kind of meaningful reversal is not permanent. It narrows with time, with continued exposure to the same inflammatory drivers, and with the progressive calcification that transforms soft, responsive plaque into hard, structural buildup that is far more resistant to intervention. That man's doctor told him something at that appointment that he said he had never heard stated so directly before. He said the doctor looked at his imaging, looked at his file, and said, "You are still in the window." That phrase, "still in the window," landed on him in a way that nothing else in years of routine care had managed to do. Because it implied clearly and without softening that there was a window, that it had an edge, and that he was still on the right side of it. If you have been watching this and finding pieces of his story familiar, the fatigue absorbed as aging, the slight changes in exertion tolerance waved away, the assumption that passing a standard physical means everything is fine, that recognition is worth something. It is worth paying attention to. The people who achieve the strongest results in long-term cardiovascular studies consistently share one characteristic. They learned what to look for before the situation reached a point where the options had already narrowed. The advantage you have right now, in this moment, watching this, is that you are receiving this information before symptoms have forced the conversation. And what he changed in the months following that appointment, and the results his doctor saw at the follow-up, is exactly what we turn to next. There are warning signs that most people over 60 dismiss without a second thought, and understanding them requires stepping back from the idea that symptoms of cardiovascular strain look like the dramatic presentations shown on television. They rarely do. The signs that appear in the earlier and middle stages of arterial narrowing are quiet, non-specific, and almost perfectly designed to blend into the background of ordinary aging. The first is a change in exercise tolerance that develops so gradually it becomes the new normal before anyone names it. Not a sudden inability to walk, a slow creep. The mile that used to feel easy now feels like effort. The flight of stairs that used to be nothing now produces a brief awareness of the heart working. The second is fatigue that is disproportionate to activity, a heaviness that does not lift the way it used to after a night of decent sleep. The third is a subtle change in cognitive clarity, occasional brain fog, difficulty sustaining concentration, a feeling of mental slowness that gets attributed to stress or poor sleep, but may actually reflect reduced cerebral blood flow. The fourth is peripheral symptoms: cold hands and feet more frequently than before, occasional swelling in the lower legs toward the end of the day, a faint awareness of pressure or heaviness in the legs during activity. None of these individually are diagnostic. None of them alone would send most people to a cardiologist. And that is precisely the problem. Because in combination, over time, they form a pattern that research consistently links to the early stages of systemic arterial compromise. That man had been experiencing 4 of these 5 patterns for at least 2 years before his appointment. He had mentioned one of them, the fatigue, to his primary care physician during a routine visit and had been told it was likely related to his sleep quality. That was not wrong, but it was incomplete. I want you to think carefully about this next part, because some of what I have just described may feel very familiar. If any of these signs have shown up in your life in the past year and you have been pushing them aside as just getting older, type the words "not anymore" in the comments. Because that phrase is where something different begins. What changes the outcome, the first and most foundational layer of it, is something that has been in use in traditional medicine for thousands of years and is now being examined with serious scientific interest in peer-reviewed cardiovascular research. And what the data shows about its specific mechanism of action is something that most people, even people who already know the name of this herb, have never heard explained this way. The herb at the center of this is garlic. Not garlic as a flavoring, not garlic as a cultural staple. Garlic, Allium sativum, as an active pharmaceutical compound with measurable documented effects on the arterial system. The compound responsible for most of its cardiovascular action is called allicin. Allicin is produced when a garlic clove is crushed or chopped, a process that activates the enzyme alliinase, which converts a precursor compound called alliin into allicin. This conversion does not happen in whole, uncut garlic. It requires mechanical disruption of the clove, and the resulting compound, allicin, has a mechanism of action that researchers have been studying with increasing precision for more than 3 decades. What allicin does inside the vascular system operates on several levels simultaneously. First, it acts as a potent antioxidant, neutralizing the oxidized LDL particles that are central to the initiation of arterial plaque formation. Less oxidized LDL means less macrophage recruitment. Less macrophage recruitment means fewer foam cells. Fewer foam cells means a slower and less aggressive plaque accumulation process. Second, allicin has demonstrated direct effects on the enzyme HMG-CoA reductase, the same enzyme that statin medications target, inhibiting cholesterol synthesis in the liver. Multiple peer-reviewed studies have shown that regular consumption of garlic extract can reduce total cholesterol by between 10 and 15% in individuals with elevated baseline levels. Third, and perhaps most significantly for arterial health, garlic compounds stimulate the production of hydrogen sulfide in vascular tissue. Hydrogen sulfide is a gasotransmitter, a gas phase signaling molecule that causes direct relaxation of smooth muscle in arterial walls. This relaxation widens the arterial channel, reduces blood pressure, and improves overall vascular compliance. That man's doctor, after reviewing the research, suggested adding a standardized aged garlic extract to his daily routine alongside dietary changes, not as a replacement for his prescribed care, as a documented, evidence-based complement to it. 3 months later, his inflammatory markers, specifically his C-reactive protein and his oxidized LDL levels, had shifted in a direction his doctor described as meaningful. What the second layer of this looks like, and how the research describes the combination that produces the strongest results, is what we turn to next. The second layer of what changes outcomes in arterial health is not a single compound. It is a pattern, a consistent, repeatable combination of behaviors and inputs that research increasingly describes as working synergistically with the primary intervention. In this man's case, his doctor did not hand him a supplement and send him home. He walked him through a framework that addressed the biological environment in which his arterial walls were trying to recover. The first element of that framework was dietary polyphenol density. Polyphenols, the class of plant compounds found in dark berries, extra virgin olive oil, dark leafy greens, and deeply colored vegetables, have well-documented anti-inflammatory and antioxidant effects within the cardiovascular system. The pre-dimed study, one of the largest dietary intervention trials ever conducted, found that a Mediterranean pattern diet rich in these compounds reduced major cardiovascular events by approximately 30% compared to a low-fat control diet. The second element was omega-3 fatty acid intake, specifically EPA and DHA from fatty fish or high-quality fish oil. Omega-3s have documented effects on triglyceride reduction, platelet aggregation inhibition, and endothelial function improvement. The third element was consistent moderate aerobic movement. Not intense training, walking, swimming, cycling at a comfortable pace. Research shows that consistent moderate aerobic exercise stimulates the production of nitric oxide in endothelial cells, a compound that acts as a natural vasodilator and plays a critical role in maintaining arterial flexibility and preventing the mechanical damage that initiates plaque formation. The fourth element was sleep. Not as a lifestyle recommendation, but as a vascular intervention. Research from the National Institutes of Health confirms that chronic sleep deprivation elevates cortisol, increases systemic inflammation, and accelerates the very processes that drive arterial plaque progression. That man told his doctor at his follow-up that the combination of these changes, not any single one of them, but the layered effect of all of them operating together, had changed how he felt in ways he had not expected. The fatigue had lifted. The shortness of breath on stairs had reduced noticeably. His morning walks felt different. Not dramatically, but differently, in the specific, quiet way that genuine internal change tends to announce itself. The results his doctor saw at that appointment and what they mean for you right now is exactly where we arrive next. You are not the person in the story who almost missed it. You are the person who found out in time. You watched this. You stayed with it. You received information that most people go years, sometimes decades, without ever hearing presented clearly, with the science behind it explained in a way that connects to the reality of how the body actually works. Everything you have learned in the past several minutes is now part of how you move forward, not with fear, not with alarm, but with the kind of clear, grounded, practical understanding that makes the next decision easier and the next conversation with your doctor more specific and more productive. You now understand what atherosclerosis is and how it develops silently. You understand what Allicin does inside the vascular system and why the preparation of garlic matters for its activation. You understand the warning signs that most people dismiss and why the window of most effective intervention is not permanent. And you understand that the strongest outcomes belong to the people who act on this kind of information before the situation forces their hand. I share stories like his because they are real. Because the people behind them are real. Men and women living genuinely healthy-looking lives who come to the edge of something serious without ever knowing how close they were until someone helped them see it differently. And because you are real, sitting wherever you are right now, watching this, and your health genuinely matters. Not abstractly, not as a category. You specifically matter. If this reached you today, share it with someone who might be where he was, before the appointment, before the finding, before they knew. You could be the reason they find out in time.
Stay with us.
We will keep bringing you what you deserve to know.